Hi, I'm Dr. Georges Benjamin, the Executive Director of the American Public Health Association.
I'm Chrissy Giuliano, Executive Director of the Big Cities Health Coalition.
Hi, my name is Elaine Alden as Chief Executive Officer of the Society for Public Health Education. I want to extend my greetings for National Public Health Week.
Hi, I'm Scott Becker, CEO of the Association of Public Health Laboratories.
Hello, my name is Lori Trummel-Freeman, and I'm the Chief Executive Officer of the National Association of County and City Health Officials. NACHR represents the nearly 3,000 county and city health departments across the country who are on the front lines of the COVID-19 response effort.
Hi, I'm Mike Fraser, Chief Executive Officer of the Association of State and Territorial Health Officials.
Hi, I'm Janet Hamilton, Executive Director of the Council of State and Territorial Epidemiologists, or CSTE.
Hello, I'm United States Surgeon General Dr. Jerome Adams. As the nation's doctor and as a former state health official from Indiana, I want to personally thank you all for your tireless dedication and commitment to improving the health of our nation.
Our members are leaders of the country's largest metro health departments, which are among the hardest hit by this pandemic. They are on the front lines, working around the clock to find answers, track cases, and slow the spread.
As public health professionals, we find ourselves at a critical time in our nation's history where we must use every tool in our arsenal to fight the deadly COVID epidemic. I want to thank all public health workers and especially my fellow health education specialists and communicators at the federal, state, and local level, hospitals, medical care settings, work sites, and schools for all the work that you're doing on the front lines.
APHA has been advocating for resources for this pandemic, educating the public, and demanding a science-based approach to the outbreak. We thank all of you for the hard work you're doing, and we stand with you.
Of course, our members are extremely involved in the COVID response, supporting emergency response activities in their states and working with federal and local partners across the country.
CSTE members are the public health epidemiologists, or disease detectives, collecting and analyzing COVID-19 data. The data they collect drives our policies and saves lives. Thank you for your tireless work, calm courage, and resilience.
Our local health departments are working tirelessly on the ground in their communities to ensure that there is contact tracing, to connect individuals who are ill, to testing into health care, and to educate their community around the virus and to dispel myths.
We all know that public health is a team sport, and I want you to know that I've never been more proud of you, the nation's public health team. Whether you're working on the COVID-19 response directly or indirectly, the fact is we need you now more than ever.
State and local public health laboratories have been on the front lines testing for coronavirus disease in communities across the nation. They've been working around the clock with our federal partners and our clinical laboratory partners to ensure a coordinated response to this pandemic. APHL members are essential to detecting and monitoring disease threats like COVID-19 that threaten our communities. To the dedicated staff of our nation's public health laboratories, thank you.
Thank you, Public Health.
Thank you, Public Health.
Thank you, Public Health.
Let us all remember that the strongest people are not those ones that show their strength by their muscles or their might, but rather their courage, caring, and collaboration. Thank you, Public Health, for all you're doing. We owe you a debt of gratitude.
Thank you, Public Health.
Thank you, Public Health.
So thanks again for all you've done right now and continuing in the days and weeks ahead. Together, we'll get through this.
Thank you for all your hard work.